When you stop thinking like the piranhas and start thinking like the great whale, how big does the ocean get then?
Right.
It gets ginormous. The opportunities are endless. And that makes you stand out from your peers. Yes, that might be scary that someone might bring up something that I don't know about or have a different view on. But when you can come across that, when we come together, everything gets bluer.
Welcome back to another episode of Behind Beliefs, Behaviors, and the Brain. I am so excited for this episode because it's been a long time coming. And I know I say that a lot. But, a lot of times with my guests, I really do enjoy having my guests on because many of them I know. And this doc right here, I know, and I've known for it. I can't even believe how many years it's been, since around maybe a little bit before the pandemic. Dr. Thea Blystone, she is the owner of Tengo Health LLC. She's a consulting clinical pharmacist. This is what we're going to be talking about today, y'all. And we're talking about this aspect of a multidisciplinary team approach. Now, before I bring her fully on, I got to tell you a little backstory. So, back in the day, I used to do a little bit of business coaching. And I remember when Dr. Thea came to me and she had this idea about being someone who supported physicians in their practice as a clinical pharmacist and how she wanted to take off the burden of some of the of like really kind of lift some of the burnout of physicians by offering these clinical pharmacy consulting services. And at the time, I mean, it still is, but at the time, burnout was really at this, we were just starting to get the language and the understanding of how big burnout was in our community. And I thought this is a wonderful idea. And so I coached her, she got started when she got started. And then we went our separate ways, not like really, but like, she's doing what she's doing. We're kind of keeping in touch on LinkedIn. And then we reconnected earlier this year. And she has built this amazing practice. And not only has she built this business in clinical consulting with physicians, but then our hospital was like, yo, what are you doing? We need you to come help us out. And so now she's consulting with healthcare organizations. So I say that to say that you never know what you'll inspire when you share your ideas with people, what you'll be inspired to do, and if you're out there and you're a coach, what you'll inspire others to do. And actually, Dr. Thea coaches other pharmacists too. So she wears a lot of hats. She's an amazing person, and I'm so grateful to know her, and I'm so grateful to have been a part of that journey. So welcome to the podcast, Dr. Thea.
For having me. It's such a pleasure to come full circle back into your world on a more professional level. I came to you for mindset coaching, and that's what I got about 8 years ago. And that started it all, my friend. So big hats off to you. I appreciate all you've ever done for me. And I love staying in connection with you. I could not have built a clinical pharmacy consulting service without the ideas and the mentors that helped foster me into what those developed today. Like my mindset was what school taught me, what the healthcare told me I was going to be as a pharmacist. And it took a lot of that work in the heavy lifting of mindset change to get me out of blinders of that racehorse only blinders versus what healthcare at large needs to have happen. And I couldn't have built Tenco Health. I wouldn't be doing TM Pharmacy Consulting, which is the piece of the business that allows me to share what I'm doing with other pharmacists across the country so that they too can show up for their community. And work with doctors, nurse practitioners, wellness clinics, hospitals, long-term care settings, like wherever they are. It really just allows us to show up a little bit different and learn that it's not just what healthcare thinks of a pharmacist is I dispense something to you. When actually what I do for patients is when they come in and see me every month, I'm actually holding them accountable. I'm actually having a conversation and supporting them in their healthcare journey. But no one sees that. Well, pre-pandemic, maybe no one saw that.
Mhm.
Post-pandemic, we're seeing that we're coming together and being
Yeah.
part of teams and
Mhm.
really coming full circle to say we have pharmacists in every community across this country. Why are we not able to show up for patients like physicians do and in support with physicians and other healthcare practitioners? And so, legacy bodies of work, right? Like I started to help
Yeah.
my own community because I saw the gaps in care. But
Yeah.
what it turned out is that I saw a gap in the pharmacy community too,
Yeah.
of we need to do and show up more because we are more. And I just thank you so much for allowing me to the space. You allowed space for my brain to think outside my racehorse blinders. So thank you,
Yes.
my friends.
Oh, it's my pleasure. The ripples, the ripples. You just don't know the ripples that you're creating, and you are transforming the pharmacy industry. And I think it's just, it's so interesting because behind the scenes, we were talking about, I was sharing about Dr. Bob Vanderhort. And I will always remember Dr. Bob, wherever he is now. And he was in Orlando when I was in Orlando in my residency program. So he may have moved on, and I don't know, who knows, he could have retired by now. But he was our clinical pharmacist. And as coming into residency as an intern, we had no idea what all pharmacists did. Right? Like the idea that we had is exactly what you said, that most people think about is that pharmacists dispense medications. But Dr. Bob did so much more than that, right? He would interface with our patients and help us and consult with us when we had patients who were polypharmacy. For those who may be wondering, patients who have like tens of prescriptions, right? Maybe 5, 6, 7, 8, 9, 10, especially members of our community who may have been in more advanced age may have, or who have multiple medical issues, even at a younger age or an earlier age, may have multiple medications. And so consulting with us on how to navigate that, maybe even how to make the medication profile more efficient, holding patients accountable, right? Like, so there were so many things that he did. And so I was fortunate enough to be aware of that when Dr. Thea came to me. And so this is sort of that transition point. I really just love what you do. And it speaks to the value of recognizing and honoring the talents, the multiple talents of different team members, rather than the competition that exists in our community.
Yeah, that's huge. And I get that a lot actually from not only like physicians say, are you staying in your lane? But
Mhm.
also like nursing to the
Mhm.
pharmacy is, are you staying in your lane? And it's like, wait, you guys are nurses and you care for people by touching them and supporting them in
Mhm.
the minute.
Mhm.
I care for them in a different way, but it's still an oath of a pharmacist is to care for our community.
That's right.
And we took that oath just like a physician does. And
Mhm.
what that means is that I like to look at it like I come in with different blinders.
Mhm.
Physicians come in with let's diagnose and get the person healthy.
Mhm.
That's a blind set, a blinder set. My
Mhm.
blinder set is okay, we have this diagnosis.
Mhm.
Like I'm not questioning, I'm just
Right.
saying, yes, okay, we have this. So
Right.
now what? And that's really where pharmacists can pick up. And then when you get over to the care part for nursing is let's put our hands on them and care for them. And then that's not the only thing nursing can
Yeah.
do, but like that's how in my brain we've aligned in the healthcare sector is that's kind of the lines. But when you come at it from that full on 360 approach in health and wellness, and quite frankly that's what the community wants today is a team approach with a full supporting system of how can we support this patient and get the maximum benefit for this patient. And that's what you get is a whole team. Like
Yeah.
it's the physical therapist, it's the
Mhm.
speech therapist, it's everyone is coming around this patient and supporting them from every angle to get the best results. And I just think in so many sectors of healthcare, we stay in our silos just because that's what the institution maybe said or the school said or healthcare at large said and insurance said, big pharma
Mhm.
said, like
Mhm.
who said
Yeah.
that's where I have to stay. I like bridging. I like
Yeah.
bridging to nursing. I like bridging to physicians. I like bridging out to,
Yes.
chiropractors, acupuncture, hypnotherapy, like breath work,
Yes.
Eastern medicine, Western medicine. When you look at it from a full circle, the patient wins.
That's
And
right.
isn't that what we're here for? Is for
That's right.
patient wins.
That's right. That's right. And it's so interesting, when we look at the beliefs behind. So, this behind beliefs behavior. So, I got to talk a little bit of behind about what's behind that, right? Is conditioning. We are conditioned. And so I used to talk about how, as physicians, this part of my work has always been mindset. And as physicians, how we are conditioned to a particular thought pattern. And so we're not only conditioned about what we can and cannot do, but we're conditioned about what others should and should not do, or what are the lines. And they're not, there's boundaries and then there's walls. And I think that it's a useful distinction because, yes, each specialty of a physician may have the bounds of what they are qualified to practice, or maybe they're qualified, but maybe their fund of knowledge needs some development, right? So those are these different boundaries, but boundaries are flexible. Walls are partitions that nothing can get through. And so we're conditioned to create these walls within our position and in interdisciplinary. We're conditioned to create these walls where that's why we get things like stay in your lane. And if we really talk about lanes, there's the lanes with the double line and there's the lanes with the dotted line. And if you're in a multi-lane road, the dotted line is meant for you to be able to move from lane to lane. And so it's okay to be able to move back and forth between the lanes in a particular way. So, I think it's useful for, inside of medicine, but if you're listening to this and you're not inside of the medical field, I want you to just really map this on to how does this apply in my industry? How does this apply on my teams? How does this apply interdepartmentally? Some of how we create these walls versus flexible boundaries.
Yeah, I love that example because I went on a trip to a third world country and it was a 2-lane road, but there were 7 cars width going down this road one way or another. And it wasn't even all on one side, we were all going in the right direction, and on the other side, they were going in the other direction. It was like chaos, complete and utter chaos. And I think, like, I love that example because there are more dots on a line with lots more traffic, and healthcare at large is a lot more traffic. Business at large today is a lot more traffic on all industries because we have the internet, right? Like, it's
Mhm,
not like this one single lane anymore. So,
mhm,
how can we coordinate and funnel the most people through where we have to
mhm.
get them to use our services and yet still be valuable?
Yeah, yeah.
It's by partners, right? And
Mhm.
partners add a lane. And
That's
that
right.
is like, and it doesn't matter if you're in the printing business or
Mhm,
maybe you're in consulting or computer software, or
mhm.
like tech, like anything. You could just partnering up with people opens up audience. When you
Yeah,
open up audience, does that mean you get to open up the lane? To some say yes, to some
right,
they say no, because
right,
then they get scared.
right.
Because I might suggest something they don't know about, or I might suggest something that they would never have thought of or never done because it
Mhm,
goes against their value. Well,
mhm.
then you create less dots in your lines.
Right.
But that doesn't mean you can't still have lines in
That's right.
those segregated spots, right?
That's right.
Like, so I love that example.
Yes. I love what you're sharing here too, because if you think about it, when minds come together, when you have those dots and you're able to share the lane, that's when new ideas emerge. And so when you're taking that team approach and you're in collaboration rather than competition, then you will find a solution that neither of you alone may have found by yourselves, right?
Yeah.
Which again speaks to the benefit for the patient, right? And in the non-healthcare sector, it may be the benefit to the customer, or it
Right.
may be innovation that occurs. And I think, sometimes when there's this resistance, it comes from the fear of maybe, like you said, not knowing something. Because again, here's more conditioning. We're conditioned in our industry, and I don't know about how you all are conditioned in your education, but that not knowing is very bad.
Yeah, not
Right.
knowing is, yeah, you're in trouble if you don't know. Like,
Right.
yeah,
Never mind the fact that there are all the resources that you can go and look it up and that we are eternal and continuing to learn.
learn and grow. Yeah.
But no, if you don't know something, then we've been conditioned to, oh, that means something. That means you're not as good of a doctor as you thought you were, or as you're supposed to be, or you're dumb, or you're whatever. Like it means something, and we've been conditioned to that. And so I think that when we start to, as an industry, dig into the individual trauma that has caused this conditioning, then we can start to break down those walls as well to be able to increase collaboration. I mean, that's a lot of the work that I do is like, well, how do we create trust? How do we create safety how do we create communication between each other so that we can more effectively and more efficiently collaborate?
Yeah. Yeah. And that's huge in what I'm seeing by doing, right? Out here
Mhm.
working with physicians, doing the thing with patient care
Yeah,
and showing up for patients is what I'm finding is the lanes get bigger with more people
that's right.
because you now have time to do what you're good at. I'm
Mhm.
doing other things that I'm good at
That's right.
for you. And it's like the audience grows. And so your availability to do your expertise grows with that. And
Mm.
so, like, I love the book Blue Ocean Strategy. Have you ever read that book?
I
I love
love
that
that
book.
book.
Yes. And
Mhm.
it talks a lot about this, right? Like competition is where the water is red because everybody's
Mhm.
biting at each other.
Right.
All the piranhas are killing each
Right.
other.
Right.
But really, when you stop thinking like the piranhas and start thinking like the great whale, like
Mhm.
how big does the ocean get
That's
then? It
right.
gets ginormous. The
Mhm.
opportunities are endless. And that makes you stand out from your peers, not
Mhm.
look like, oh, maybe I don't know that. Yes, that might be scary that someone
Yeah.
might bring up something that I don't know about or
Right.
have a different view on. But when you can come across that and really support each other with that in different industries, or like me versus a physician, right? Physician to pharmacist, like
Mhm.
we're cross disciplines, but yet when we come together, everything gets bluer.
That's right.
Everything.
Everything. Skies and oceans get blue.
Right. I won't say that it's a cakewalk, right? Like there's problems and things that you have to work through when you go into a business agreement with anyone, right?
Right.
Like it doesn't matter. There are things that are hard about any collaboration, friendship, any relationship. It's people working with people can be hard sometimes. However, when you can embrace hard and keep moving forward anyways, that's lifelong learning and that's growth. At the end of the day, that's what we're here for. To
Yes.
move and grow and support each other.
It's interesting that you say that because as you talk about that there are difficult things, I think another fear that can come up is feeling of threat to identity and a fear of conflict.
Yeah.
And I think once again in our industry, we're not taught how to deal with conflict. But conflict and difficult conversations is a natural and normal part of relationship in general. And it's not a threat to identity, right? So we can
Right.
maintain our identities, we can even expand our identities, which is essentially what you're doing in the pharmacy world is expanding the identity of what the role or who pharmacists are. And in the
Right.
same vein, what I've done for all these years is like expand the identity of what physicians and other healthcare professionals can
Right.
and cannot do. And so part of that is expanding the shared identities of the relationship between people, between industries, between departments. And so I love that you're talking about that because I think part of this fear of, oh, this threatens my identity as a doctor if a pharmacist starts calling themselves a clinical pharmacist. Well, no, you are clinical. What are you talking about? You do interface with patients, right?
Yeah.
And it's a similar thing, I think, with advanced practice nurses and nurse practitioners, PAs, is like there's this unfortunate tension because there's a generation of APPs who are feeling like they need to be in competition with rather than in collaboration. And I think there's a generation of physicians who feel like that they're encroaching upon our territory, right?
Right.
So how do we learn how to say, look, this is what I can do for you, and this is something that I'm alluding to for what you told me originally was this is what I can do to take the some of the burden off, some of
Mhm.
the so that you can focus on what you love to do and what you do best, right? Essentially lightening the load and potentially avoiding the road of burnout,
Yeah.
avoiding that road of exhaustion. And so that's what I love about what you're sharing here.
Yeah, and I think that goes across all industries, right?
Mhm,
It may be where our example is you versus me, physician versus pharmacist, right?
mhm,
Versus, no, we're together in this. We've
mhm,
come together because of mindset, wanting my mindset needed developed because I thought, like all the other pharmacists in the world, that I was only this in the
mhm,
box. And
mhm,
that's not true. But across all industries, I would pose the question to anyone out there: are there collaborations that scare you? Because if they
mhm.
scare you, they're keeping you safe from what you think is safe or you should be fearful of because you said our conditioning has told us that. But I
Right.
would say lean in. What
Yes.
does it hurt to lean in and build a relationship? Okay, you might
Mhm.
find that they're not for you and that won't work because of XYZ or regulation ABC,
Right.
whatever. But there's a lot of times that it opens more doors than it closes.
That's
You
right.
may close a couple. I've done that with physicians, right? Like physicians have gone away from my services because they felt like they could do it better. And what I found is they had other healthcare practitioners do it, but their patients still called on me as their pharmacist to
Mhm,
answer those questions. And so
mhm.
I would say, what is the client experience? Could it be enhanced, whether it's
Yes,
a patient or a customer?
yes,
Doesn't matter. Could it be enhanced because you're broadening your
that's
horizons?
right.
The
Right.
opportunities out there, right? Like it's
Bringing it
everywhere.
all back, all the way back to
Yeah,
the client or the patient. And
right.
that's the at the end of the day, and it's interesting what comes up in my mind is also, and I know this is sort of like jumping adjacent, but I think about I'm a co-parent, right? And I am for what some people say like a little bit of a unicorn inside of my community in that me and my co-parent we're tight. Now we're not enmeshed, but we have a really good relationship. And it was because at the very beginning of when we decided to to split up as a couple, we maintained that the most important person was my son, our son, right?
Right.
And so there were some parameters around that. Like my son's dad is my son's dad. He's a great dad. He'll always be his dad, and I will never keep him away, right?
Right.
And I respect him and he respects me. And are there like, do we have our moments? Of course, because as you said, conflict and difficult conversations are a normal and natural part of relationships. But my son has been lucky enough to grow up with, while we're not together in the same household, with two parents who he absolutely knows love each other and love
Mhm.
him.
Right.
And so, like, it just made me think of that. Like, in any situation where there is a person who is being served or cared for, and you have an opportunity to collaborate, think of the end result or the person who's on that end who's being cared for, and that'll give you how you really should be collaborating. Not because if we're squabbling, we're making it about us.
Mhm.
We're making it about identity. But when we are thinking about the client, the customer, the child, the family member, the whatever, then we're looking at what's the best outcome for
Right.
that.
Yeah, and I love that example because, you didn't have a son to share custody with or share, right? Like
Right.
you had that son because you were happy in that relationship and you wanted the next generation to be supported from that relationship.
Mhm.
And when you can walk alongside that and say, I don't have to be your best friend anymore, but the best thing for our child is healthy boundaries. Like I'm a co-parent too. Like I have two kids co-parenting and I have two
Yeah,
stepchildren, so another set of co-parenting, and
yeah.
like it is about healthy boundaries. And I think
Mhm,
that comes back to the conversation that any collaboration needs healthy boundaries. You
mhm,
wouldn't let your 15-year-old go out all night. No, they
mhm,
have a healthy boundary. Why? Because you love them. You want them to
mhm,
excel and
mhm,
exceed. And so patients need that. Clients want that. Like,
mhm.
when was the last time a customer service survey came back in and said, "Oh my gosh, you're doing everything and you support me all the time," and like all bells and whistles? You don't hear about those anymore
Right, right.
because people are busy
That's
and
right.
no one is showing up for anyone. Well, I am coming and saying I want to work with you to
Mhm.
support you, and it's because of fear a lot of people don't. But I
Yes.
will say that those that do are rewarded with clients who love it
Mhm.
and who have more time. Just think about my example, right? Like I put a monitor in a home for a patient to use to check and make sure that the regimen you put on a patient is actually working for them. You get to evaluate it once a year when you see that person. For
Mhm.
7 minutes is the average you get to spend with them in an office visit.
Mm.
7 minutes. They have 5 chronic conditions and 15 meds is the average. Those are averages today in the
Mhm.
Medicare population.
Mhm.
Okay, so in 7 minutes, what are you talking about? How do you know if that blood pressure medicine is working for them?
Right.
You don't know. You're just taking it at face value, what you talked about. But
Mhm.
here I am supporting you and saying, oh, I have a blood pressure cuff. It's in Mrs. Jones' house. She
Mhm.
uses it every day. And oh, by the way, everything looks really good.
Mhm.
Or she's not taking her meds, or she needs something else changed. Or,
Mhm.
but it comes back to the relationship you have with your client and
Mhm.
me just supporting that.
Right.
And that can happen across industries. And I think it happens across co parenting as well,
Yeah,
for sure.
for
But
sure.
healthy boundaries
Yeah.
of let's have a segregated line of traffic that we can cross and mingle and
Mhm.
get to the greater good
Yeah.
because it's there.
It's there. Absolutely. Absolutely. Wow. We could talk for hours about this because there's so much to talk about. I want the audience to get a sense of what you do because we know we have people from all industries, but we do have healthcare professionals, we have doctors, we have organizations that listen in. So tell a little bit about how you work with physicians and with organizations.
Yeah, thanks. So it really comes down to care management services, helping physicians with care management services. A lot of physicians, especially in rural America where I am, we don't have a lot of resources here. And so they couldn't afford a clinical pharmacist on their team. So we are consulting with those folks to be able to offer services between visits for their patients. That is, like I said, support, education, accountability, all of the things between office visits. Every month, the patients are being supported by us. My team is helping me with that now. I have a team of people, a pharmacist, a nurse practitioner, a LPN, an RN, and a pharmacy technician. So my team is continuing to grow, and we're just really supporting the physicians and health systems across all healthcare, right? Like specialists, like cardiologists and nephrologists and disease state specific specialists, but also just general practitioners as well, family medicine and primary care, but really coming in alongside and helping drive better outcomes for the patients, which helps grow the relationship with the patient and the provider, but also it helps with the quality metrics that the offices are dealing with on how to make sure they're getting their highest reimbursements and making sure that their patients are using preventative care as opposed to post preventative care, like things,
Yeah.
and using acute need versus preventative stuff. And this really helps enhance all of aspects of trying to get to a wellness setup for patients, looking at a patient wholeheartedly and saying, what can we prevent? And can we support you to make better choices to drive better healthcare down the road? And that's really what we're able to do. And so, I'm always out posting on LinkedIn through TM Pharmacy Consulting and Tenco Health, really just doing that, making sure that we're sharing the vision with the world because quite frankly, every community across this great country
Yeah.
needs more people supporting patients.
Absolutely. And then that transitions me like talk to me about or really talk to the audience because I know about how you support other pharmacists in, expanding their capacity to serve.
Yeah. So Tenco Health is my service line out to providers, but TM Pharmacy Consulting is where I educate other pharmacists. So I have a course that allows me to help support the next generation of pharmacists leaning into care management. And that course is called the Pivot Program. There's the course plus all of the materials that I use to set up my own business over the last 7 years to be able to help someone else not have the struggles that I had of, once you get the concept of I can do more, what do I do then? And it took almost 2 years to figure that out. But what I found is that's not necessarily the case today, where pharmacists don't necessarily have to wait that long or struggle that long when you have someone who has a model that is replicable and has been replicated across the country. And, it allows for them to streamline the process and really start seeing patients and helping the community quickly.
That is so amazing. I love it. I love so much how you not only have you expanded what you do as a pharmacist, and then you've duplicated that
Mhm.
across the country, but now you are now duplicating it. You're extending those tentacles out. And so, you're duplicating yourself, but you're duplicating it by creating others who can as well and helping to empower a whole new generation of pharmacists. And I think that, as time moves forward, and especially as we move forward in this sort of new administration, we're going to see a lot more, I think, more private practices pop up and more need for this type of support, this type of collaboration, this type of alliance inside of private practices as well. So this is going to be a big opportunity for those pharmacists who are making those transitions to be able to partner up, and for physicians to be able to create these multidisciplinary practices that serve in a bigger way.
Yeah. Yeah, I love it. And I think that's the future of healthcare is we have to take it back to being personal, and it has to be every patient every time, right?
Yeah.
Like that's I mean that's what the healthcare needs from us, because growing at the masses isn't throwing stuff at the masses isn't
Mhm.
helping. We got to make it personal because we are human, and that is the human experience
That's
is
right.
get personal.
That's right. And on that, but that is a drop the mic moment. Get personal.
Get personal.
And so I encourage you all who are listening, if you're not in the healthcare, I mean, really just think about, how does this apply in my organization? How does it apply on my teams? How does it apply if you're senior leadership in the different departments and the that you're running in the organization? Even if you're a leader in a hospital, how does this apply across different domains, and see, how you can begin to think differently about this multidisciplinary team approach, and not just from a logistics standpoint, but from a mindset standpoint. I think that's what's really important, is you can create policies and procedures, but if there's no mindset, there's no collaboration. So that mindset of multidisciplinary, that mindset of honoring each person's expertise, that mindset of collaboration versus competition, I think that is going to be the most important thing moving forward, for us to give the best care and for us to continue to innovate in the way that we want to moving forward.
Yeah,
Yeah.
for sure. Patient experience at the heart of it. You'll
Mhm.
find opportunities everywhere if you just look.
Exactly. Exactly. So, well, now, if there's any listeners that want to reach out to you, if there are any doctors who are like, "Oh, I need to talk to her," if there are any pharmacists listening that are like, "Oh, you know what? I really am ready to expand my experience," please tell us, how can they reach out to you?
Yeah, I'm on LinkedIn at Dr. Thea Blystone. I'm over there every day, all the time. So just connect with me over there. You can also go to my websites. My website for Tenco is tenco.health. My website for TM Pharmacy Consulting is tmrx.care. Both have care and healthcare in there.
Awesome. We will definitely have these in the show notes. You'll be able to like go and read the show notes and get low down on the conversation, but also be able to connect with Dr. Thea after the show has aired. So, oh my gosh, this was such a great conversation. And I really cannot wait to share this with my colleagues, because as I shared with you before, this is a conversation that we've been having, and so I think this is such a timely conversation. I can bring this and say, "Hey, we I just talked to one of my friends and colleagues, and you all want to hear this conversation." So thank you so much for being here with me today, but also just for being a part of my world. I
Yeah.
appreciate your friendship and your collaboration. You connected me with a few people over the years as well. And I look forward to many more years of growth.
Yes, me too, my friend. Thank you. It all started with a little mindset shift, and you helped me with that. So thank you so much. It's been a pleasure.
Absolutely. Well, you all heard it. Go check out Dr. Thea Blystone, and please share this episode. I mean, you may not be in healthcare, but you may know someone who is. So share this with a friend, with a family member, with a colleague, with a leader in your life. This conversation is really universal. And so make sure that you share this episode with a few people in your life, and also leave a review. if you can, whether you're on the Apple or the Spotify platform or any of your platforms, leave a review because it's important that the people who are coming behind you listening know that we are making a difference in these conversations. So with that, I thank my listeners because without the listeners, there is no podcast. And thank you again, Dr. Thea. I appreciate you so much. And until the next time we see each other, you all stay empowered.